In the course of my work as a pastoral chaplain at the University of Minnesota Hospital, I was assigned areas of the hospital that had to do with leukemia, blood diseases, and also intensive care. In the course of that time, the news-breaking events had occurred, particularly in San Francisco. And then the first AIDS patients came to our hospital in Minnesota, the University of Minnesota. And I was aware of the trauma, part of it being the young people coming, young men, that they were alienated from their families. And even in my experience, and this is only a little bit of my experience, that some nurses were so afraid to be present to their patients on a floor. Very few doctors even wanted to see these people as they were diagnosed. So I decided to pay attention to this, because that was my responsibility, to be aware of what was happening to the patients. So I went to see Dr. Frank Rhame, and I remember the day, and I asked for an appointment in his office, and he shared his concerns that how rapid this disease was being known to everyone, infectious disease. And in the course of that, I said, I'm concerned, what can we do as, really, I think I used the word as pastoral care. And he responded, be with us. So he named where the areas of concern: family relationships, the support services for the individual, helping the nursing staff and the doctors who would be involved to, in some way, become more educated and let the fear go. So from that, I met then with Michael Osterholm, and I walked over to his office in the public health building and had an interview with him as to how we might respond. Well, he was most enthusiastic in saying we need to educate the community, and the churches need to be present with us.